Patients often ask me about dislocation of their hip after hip replacement surgery. Although hip replacement is a very successful procedure and the vast majority of patients have complete relief of their pain, a very serious complication is hip dislocation. What happens in a hip dislocation, and I can show that to you on this model, is that the ball pops out of the socket and it comes out like this, and once it's out of the socket, it can then travel up into the muscles, up into the hip, and get stuck there. That's a big problem that frequently requires a trip to the emergency room to have that put back into the socket. When the hip replacement surgery is done through a traditional approach, also known as the posterior approach, dislocation can happen about 3% of the time. This can happen right after surgery or sometimes several years down the road. The reason for that is that the posterior approach weakens certain muscles that are very useful in keeping the ball in the socket. That's why after a traditional hip replacement surgery, you would be given certain restrictions, such as not bending your hip past 90 degrees, not sitting on low stairs, being very careful about getting on and off of the toilet, and never picking anything up off the floor. That's because the traditional approach has a higher risk of dislocation. I choose to do the surgery through the muscles in the front, called the anterior approach. When you go through the anterior approach to do the hip replacement surgery, the chances of dislocation are 0.3%, so 10 times less common than through a traditional approach. I keep the strong muscles in the hip together so that those muscles that help prevent dislocation are still maintained intact. Those muscles continue to be strong, and they're strong enough to keep the ball in the socket. That gives me the advantage of being able to keep the length of the hip the same on the operated side as the other side, and it also gives you the advantage of having a hip that is stable. I don't have to give you any restrictions after surgery, and I allow you to do what's comfortable. So the best way to prevent hip dislocation after hip replacement surgery is to listen to your surgeon if you've had a posterior approach. If you've had an anterior approach, you can start activities as you feel comfortable, and all you need to do is listen to your own hip.